Life Healthcare, previously listed on our exchange here in Johannesburg as Afrox Health, spun off out of the Afrox group because a couple of hospitals, I often make that mistake, didn't pay their oxygen bill. They've now grown into this substantial private healthcare group. They've got assets in India, but they are now listed in their own right on this market. And one, in fact, of the largest players, mushroomed to a market cap of just shy of 40 billion rand. Incredible performance since their relisting. Price to earnings ratio 24.5, dividend yield of 2.6. So Rob, that share chart is a little bit shorter, and it was almost like when it came back to the market, it immediately got the sort of benefit of the comparisons. It was a good time because people were worried about Netcare and Mediclinics offshore exposures, capital structures, and these guys looked, since then, have been a bit more sideways there. Huh?
Yeah, so a very big run up. I mean, I think it must have doubled or tripled. I think it tripled within a year and a half. So a very big growth story. People made a lot of money out of it. They're actually probably at the same amount of beds as Medicare. They could actually be going into second place on the size of their healthcare. So
what's it, 7,000 odd beds or something across the country?
Across the country. And they're not as specialized as Mediclinic. They offer slightly lower priced private medical care. Mm-hmm. So they're slightly one lower LSM group. And they've done very well on that side. So you have to say, well, is that section of the market going to grow? We think it will grow. So you're thinking of people that are having children and they don't need very, very high care that you find at a Mediclinic, and they're going to a life healthcare. So
and I've noticed that a lot of people in South Africa are getting these sort of secondary medical aid packages, where before it was only the well-paid executive staff. Now more and more of the middle-tier staff in organizations are getting this sort of discount version of, say, Discovery, which does give them access to critical care in places like this when they need it.
Yes. So, I mean, I think it's a very good market, but at the same time, they've grown so quickly, and now they're consolidating the business quite a bit, and you can see in the share price is slowly just starting to consolidate at these levels. They're also only based in South Africa. So they're not getting any of the benefits of growth out of South Africa at the moment.
Although they have put their toe into the Indian market, right? They bought, I think, 26% of some Indian healthcare group called Max or something like that. I don't know too much about India. I've never been there, but I mean, that's an astonishingly large population. So doesn't that give the share some sort of upside associated with that?
It could. You have to read into it, into the actual transaction more. But you need, for these hospitals to work, you need relatively wealthy people. Obviously, India has got a big population and wealthy people, but it's also got a huge population of very poor people that won't be able to maintain medical care. So it's a difficult market to be in. There's also a lot of problems with backhanding and underhanded, and you have to know the right people in India. So it's a very difficult market to do business in, and we'll just have to see over time if that's
and all kinds of foreign ownership rules and that kind of thing. No direct management control, probably. Okay, so at this price level, we've got Mike Fleming still at the helm. My mate Adam Pyle is the head of investor relations. I also like to give him a shout out. This is a stock which, we can see here. We have, in fact, owned it at various times. As hot as the others? Where are you on this one?
No, I don't think so. I think it's going to consolidate at these levels, maybe a rand 50 on the upside. So at the moment, I'm not hot at these levels. I think it needs to pull back a little bit more.
Okay, well, I'm going to go with hot. I like